Good afternoon. We're excited to have over 180 registered attendees for today's webinar, which is eligible for 1 credit from the. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt. This trivia question. July is National Hot Dog Month. What is the most popular hot dog topping? Answer now using the questions feature on your dashboard. While you're answering, I just want to remind everyone that if you've missed any of our previous webinars, you can watch them on our website, webinarwednesday.live, and still receive a credit as well. For our webinar week, which takes place from July the 26th to the 29th, each feature a live webinar, plus be automatically entered into a drawing for a grand prize of an all-expense paid trip to MD Expo in Tampa in November. Great. For more information, visit our webinarwednesday.live. Also, just a reminder that the first of our HTM month, August the 19th and 20th at the Omni Interlocking Hotel in Denver, Colorado. Supported by KBIT, please join us for 2 days of valuable continuing education engagement opportunities in a slightly modular, safer environment. Registration is open, and for more information, Colorado mixer and our other mixers in Wisconsin and California, please visit htmmixer.com and see who the winner of our webinar t-shirt is. It is Timothy Wade. Timothy, the correct answer. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo helps companies enterprise assets using modern mobile real-time reporting, leading .com for more information. Our Dustin Smith, Senior Solutions Consultant, and Heidi Horn, Vice President, Global Enablement-Healthcare. Heidi, you may begin whenever you're ready.
Okay, thank you, Linda. And somebody is going to have to tell me what the answer to the hot dog question is, because I think she cut off on that one. But welcome everyone to Nuvolo and Technations, Enabling the Connected Hospital, How to Solve Coordination between HTM, IT, Facilities, and Clinical Care Departments. Next slide, Dustin, please. Okay, so before we get started, we wanted to introduce ourselves. And again, we want to thank all of you for taking time out to talk to us and listen to us about the Connected Hospital. So my name is Heidi Horn. As mentioned, I'm the VP of Global Enablement for Healthcare at Nuvolo. I've been there for about a year. And prior to coming to Nuvolo, I actually was the VP of Healthcare Technology Management for a large health system, 24 hospitals in the Midwest, and had been in the HTM department for about 20 years of my career in various sundry positions working for HTM. So have a broad wealth of knowledge and information that I'm going to be sharing with you today. Dustin, if you'd like to introduce yourself real quick.
Thanks, Heidi. I'm Dustin Smith. I'm a senior solution consultant with Nuvolo. I've been with Nuvolo for about 4 months now. Prior to this, I was with Enablement-Healthcare for almost 14 years. And the last position I held with Intermountain was the Director of Central Support with Healthcare Technology Management.
Okay, so let's go over what we're going to be talking about today. And so you have a framework. So we're going to be talking about connecting HTM, IT, facilities, and other support teams within the hospitals. We're going to do some business use cases that looks at how things are done now versus how they might be done in the future. And we'll talk about some benefits of improved patient care, compliance, cost savings, etc. And then Dustin's also going to be going through a demo to show how that connected hospital looks from a software type of, from a Nuvolo connected hospital perspective. So a couple things we want to go through here. So as you all know, for those of you that are in hospitals, there are many, many different teams and departments that support patient care and are part of that, what we call the connected hospital. You have your healthcare technology management, or clinical engineering team that is responsible for clinical equipment management, the maintenance. They get involved with purchasing, as we all know, making sure that everything's regulatory, there's compliance there, that purchasing parts, etc. So anything dealing with clinical equipment, the HTM department gets involved with. You also have your facilities management teams, as we know, that's in charge of the plant itself, the equipment that's non-clinical equipment, in the plant, design, build in some cases, information technology that's responsible for all the computer-related equipment, servers, the network, software, applications, etc. Supply chain and finance, which again get involved with capital equipment planning, part supply procurement, financials, budgeting, so on and so forth. And then there's a whole host of other departments, clinical, but that we're kind of calling clinical care departments, that also support patient care, such as the pharmacy, nutrition services, and linens. But as we know, these departments, for the most part, have always kind of operated very, very independently. We're seeing more and more of it occurring where that they need to work together, especially now that we're seeing more equipment become clinical equipment and facilities related equipment become more computerized, networked, that sort of thing. IT starting to get involved, but there's still, they're operated independently. There's not a lot of cooperation all the time between the organizations. And when they are forced to work together because there is some component that they have to all support, for example, like whether it's something that is networked, a clinical device that is networked that needs the attention of IT, or there is a chiller that's supported by facilities, or airflow concerns in a particular room that facilities support. The involvement is there, but it doesn't always go well. And I think we can all look back at our careers and say, that probably could have gone a little bit better with better communication and better coordination between the groups. That unfortunately is just the way it has evolved in these hospital organizations. It's not set up that way. Next slide, Dustin. So to add to the complexity of the problem is that we also know that each one of these departments have their own systems that are used to basically monitor what they're doing, their workflows, and monitor the equipment that they are supporting. For example, HTM and facilities have computerized maintenance management systems. Usually they're separate systems. They each have their own. And they're each tracking different things, tracking them different ways, have different SLAs, for example. Everything's done a little bit differently. IT obviously has its own system as well that's tracking incidents. It's looking at project resolutions and workflows and asset management. When these teams have to work together, there's obviously no one system that will, until now, I'll give you the teaser, that will look at all of these different components that are involved and track workflow and everything else holistically. Enterprise resource planning is a system. The ERP system is something that the people in charge of capital planning, the finance and support team folks are using. So that looks at purchasing, expense and supply and financial tracking, and hospital capital and non-capital expense tracking, that sort of thing. Again, that is used by all of these groups in some form or fashion, but it's done very kind of independently of each other. And then, of course, cybersecurity monitoring is another whole system that is done independently of the others to track different real-time monitoring and alerts for network-connected devices that might be clinical devices, might be facilities-related devices, or IT-related devices. So again, as you can see, and I'm trying to set the stage here, we have a very, very complex environment within these hospitals, very independent departments and teams that are trying to work together but do not have the tools to do so. So I'm going to turn it over to Dustin now, and he's going to go through some examples of how things might look differently in the future. And as we know, we are now into the future. We were talking earlier today before we started this webinar about how we're doing these everything's Zoom related, and how how it's these things have changed. So we need to look to the future in order to optimize our hospitals and optimize what we're doing and be more efficient eventually. So Dustin, you want to take it from here?
Thanks, Heidi. So when we're talking through business use cases for the connected hospital, the biggest thing we really need to think about is that coordination. How are we going to get the different groups together to ensure that our clinical devices are ultimately maintained appropriately and we're minimizing any downtime? So one of the first use cases that comes to mind is really relevant today and over the past few years is medical device cybersecurity. So depending on the way your organization is set up right now, if you have some sort of a cybersecurity scanning tool, you'll likely have recognition of an event, or you could even have recognition of an event from your IT team. And the question becomes, okay, so there's a problem, but where does that go? And so the questions that come up are ultimately, is this a medical device? What kind of a device is this? What's the threat? Who owns this device? And ultimately, who owns the response to the threat or vulnerability? Who do I contact? And really, what is our remediation plan? And unfortunately, you lose a lot of coordination throughout those steps, depending on the way your organization is set up. It becomes a question of, is this going to go to IT? Is it going to go to healthcare technology management? And how do you coordinate that effort? So our solution is, you have something that's going to sit ultimately between your CMMS and between your vulnerability scanning system. And so now what you've got is you've got a system of ingestion that's going to take not only the information related to those devices in your cybersecurity solution and put that into your CMMS, but it's also going to take any of those vulnerabilities and threats that come through, and you can make a remediation plan. So as that threat or vulnerability comes into the system, you're able to suddenly get the appropriate information to really drive a response. If you need to send that information over to IT, instead of asking, is this a medical device, they're not only able to see that it is, but they'll have the manufacturer information, the model information, the patch level, serial number. And the biggest areas where you're going to benefit from your CMMS is going to be where it's at, who owns it, and what's the HTM technician that they may be able to reach out to if they encounter any issues. On the other side of that as well, if the response needs to be driven by HTM, you're able to identify which asset you're hitting, because instead of simply getting a MAC or an IP address, you have the context of what it is to you. You've got the device level information, you know the make, you know the model, all that information that is ultimately tied to an IP or MAC address, that in the past, if somebody put a MAC address in front of you, unfortunately, you don't know what that is, but now you've got that context so you can actually go and remediate as appropriate. Our next example, imaging equipment's complicated. Unfortunately, you've got a variety of different teams that are often working to maintain the imaging equipment. You've got IT that may be helping out with your workstation or even your PAC server. You've got facilities that may be helping out with chillers. And then you've got HTM who's ultimately owning the device. And so if a particular issue comes in, one of the areas where you can experience some loss of coordination is right when it hits HTM. As you go look at the device and you find that there's ancillary groups that need to help you address this issue, do you have a meaningful way to get IT there? Do you have a meaningful way to reach out to the PACS team? And then also facilities, what's the easiest way to get someone there as well? And so the solution is a system in which you can very easily be able to push work, not only from your work order, But also, if you needed to create an all new work order for a different group, you need to be able to do it as quickly as possible. And that's something that we do believe we've provided a solution for, and that I look forward to demoing later. And then our last use case to really go through, Heidi spoke to some of the other groups that may be assisting in really ensuring that your connected hospital is taken care of. And one of those larger groups is going to be finance. And when it comes to your capital planning process, do you have an excellent seat at the table and a good means to communicate with finance? And then also, how are you coordinating with facilities? Oftentimes, we're going through dramatic remodels of our facilities because we have aging infrastructure. Do you have a good way to sit side by side with facilities and say, here's our all-inclusive need? Not only do we need a new MRI or a new X-ray, but we need a total rad room, or we need a new suite. And what does that look like, and how can you appropriately present that information to your finance team to get the appropriate prioritization? So after going through those just really quick three potential use cases that we'll be demoing later, what are the benefits for having ultimately a connected hospital and improving that coordination? What are the positive outcomes that you're going to get through having a fully connected solution? Well, first and foremost, improved uptime. And a lot of that is going to come through ensuring that you have the appropriate parties in place whenever an issue arises, and also being able to proactively plan. You're going to have more reports available in real time. And that's ultimately, it's going to assist in driving decisions and reducing regulatory risk, but it also is going to make your teams look that much better, and it'll be that much easier to get the resources you need as healthcare continues to expand, or you're starting to take on additional modalities. You're also going to create cost savings opportunities because you're going to be able to identify additional information. Faster remediation of equipment issues. And a lot of that, again, comes back to the same reason you're going to have improved uptime. And that's just much better coordination between your differing groups. Improved cybersecurity. This is going to be driven from you've got the appropriate parties assigned to the work. And you're not sitting there waiting, trying to figure out who owns what. And how do you address a MAC address that you don't even know what it represents? And then lastly, process integration with different systems. One of the things that Heidi brought up specifically was the ERP. Once you have that integration with an ERP, suddenly it can expedite your processes and allow additional information to be gathered. And with that, we're going to go ahead and start the solution demonstration, going through those three different use cases. All right, so first, we're going to go through a cybersecurity threat or vulnerability and what a potential response would look like. So it really started out with coming through your cybersecurity tool. And there's going to be a recognition of a particular threat or vulnerability. Well, our cybersecurity tool is going to go through and process that information and assign it to a particular asset. So we're going to go look at a particular security event that's open and talk through ways that we're going to get it to the appropriate party. So I'm opening my security event, and immediately I can see, where did it come from? The data source is going to be Metagate in this example. And so it came from the particular cybersecurity tool that I'm utilizing in my particular hospital. And I can see that it's a vulnerability. I've got a very brief description of the vulnerability, some additional information. when the event was detected. And really, this is the biggest benefit right here. It's automatically mapping to the devices within my organization. So I'm not trying to figure out what does this MAC tie to. My system has done it for me. And what that's doing is it's creating additional context. And that context can be helpful for either HTM or IT, depending on what the vulnerability is and what the particular response needed is. So I can see that I've got these 3 Philips that were impacted. I've got my model names. It also went through and actually created the appropriate work orders, and I can see that they're already assigned to engineers. So we're going to put boots on the ground to fix this. And then I've also got a security incident. This security incident is the work order that's ultimately tied to our IT team. So in addition to having HTM go out and work on this, we've also got IT involved. So if they need some sort of response, it's very easy to not only assign that, but also track that the work that they provide. And if I go look at this particular vulnerability, I can see some additional information, and this gives me the opportunity to really track this vulnerability from cradle to the grave and see when this is actually closed out. All right, I've got the solution information. So it says I need to patch at the device, and the patch cannot be deployed remotely. This will mean that we need to actually get boots on the ground, go out, pull those assets, and either take them back to the shop to flash them, or if we have the capabilities, be able to flash them in the location that they're in. So I've brought up additional context and the way that flows. Depending on the cybersecurity tool you have, we are going to have that bilateral communication where we're not only updating the cybersecurity tool, but it's also updating us. And so some of the information that may be passed back and forth, especially when it comes to, depending on who's looking at your cybersecurity tool, or even when it comes to the security incidents that are created and getting your IT team there, there's certain information they're going to want to know, like who owns the device, what department, and then also where was this asset last located. That's going to assist them in getting to the device to get that remediation started as quickly as possible. You may want to know the last maintenance date. It's also very important to understand what engineers assigned to it. If IT is having some struggles or needs additional information, who are they going to reach out to really get HTM involved? So these are some of the ways that we feel we've created a better mousetrap, and we're ultimately solving some of those cybersecurity coordination issues. And one of the things we've also started thinking about is the landscape's changing when it comes to IT and HTM. We're now seeing more and more hybrid engineers, and because of that, we wanted to start thinking through what their workflow would look like. So we've created a dashboard for what we call a SOC engineer that really sits directly in between IT and HTM and is ultimately hitting both sides. And this is going to look just like an HTM's dashboard, just a regular technician's dashboard that they may log into in the morning. The only difference is it's really focused in on those threats and vulnerabilities and the appropriate ways to respond to those. And we've got this set up in such a way that we can see if I've got particular hospitals or customers that I need to assist, I can see the events on that view. I can also see the events from an asset type perspective. And then we've also got unknown events. So any of those devices that recently underwent discovery and came into our system, but we haven't gone through and validated that those are medical devices and really plugged them into the CMMS. And then lastly, this idea of cyber health, of really being able to go through and see what's the information that's missing that I need to be able to link up to my cybersecurity tool? And this is going to be an area where, you know, the next time you're performing a PM on these particular devices, you can make a concentrated effort to get those IP and MAC addresses put in. So our next example was going through and making a corrective maintenance on a particular imaging device. So we're starting here at our portal, and this is what a clinician would be looking at when an issue comes up. And this is something that they would hopefully be familiar with, and they understand how to report any of their issues. So you can see that it's tied to me. I've got an understanding of any open requests that I have, but because we just barely had an imaging device go down, we're going to go ahead and make that request. So as we come in here, I've got not only some facilities requests that can be made, but also clinical requests and lab requests. And this, again, it all comes back to this idea that everything is in one place. We are finally connected. Let's make this as easy as possible for clinicians to go through and request service so that they can get back to taking care of patients. So I'm going to report a clinical device issue now. And thankfully, my organization has done an excellent job tagging all of my MRIs and all of my imaging equipment. So I'm going to say that I'm having issues booting the device. I go ahead and submit that ticket. And now a work order is being created that will actually go out to HTM based on whatever routing that my organization would like to use, or it simply goes out to a shop and then people can go out and find it as necessary. If I needed to send additional information to the engineer that may be responding to that, I can do that right here. So with that, we're now going to step into the role of the engineer, and we're gonna go ahead and go out and look at the MRI and see what's going on with it and see if there's any additional work that's needed. So I'm just going to search for my asset that I just put in the work order for. And here's the work order that we just created. I'm going to go ahead and open it up. And as I get to the device, I start to realize that maybe there's some other issues behind this. Maybe something's wrong with the chiller. Maybe something's wrong with the particular workstation. And maybe I need additional people to come out and look at this. So after discussing the issue with the clinician, I start to find that it does sound like it's something related to the workstation, but I don't know that I have the capabilities to actually resolve that issue. So I want to call in IT. So if I click on this clinical work order tasks and I create a new one, just through here, I can say I want IT services. And I know that Ben has been someone that has helped me in the past with this particular device. So I'm just going to say, can you please come look at the workstation? And if I want to, I can assign a due date to it as well. I go ahead and hit submit. And now, just like that, I've got a task that is going out to IT. And depending on how my organization wants to set up my workflow, we could set this up so that I can't even close the work order until Ben has came and looked at that. But in addition to this, as I was talking to the clinician, there were some concerns brought up about the chiller. And I don't think that it's necessarily related to this issue, but at the same time, it does sound like I would like to have facilities come take a look at the chiller. So I can go ahead and open my dependency views, and I've suddenly got a map of how my MRI is related to other assets in the system and also the location. So I can see my chiller right here. So I'm going to go ahead and open up that device record. And I'm actually going to create a new work order just to have someone come do a visual inspection. And just like that. So not only was I able to get IT to come look at the workstation for me, but I've also set up a completely separate work order so that facilities can come take a look at the chiller at the time of their choosing, because I don't think it's necessarily related to this particular issue. So you can start to see the coordination of work, it's changing. Instead of having to figure out like, oh, how do I get so-and-so's phone number? And if they're not available, I don't necessarily know who the backup is for facilities or even for IT. I can actually create those work orders and tasks and take advantage of whatever assignment rules you have within your organization so that that work is going to end up on the appropriate individual as quickly as possible. So one of the questions that's likely to come up is, well, what does this look like for an individual? Because when I first started my day, I'm looking at my HTM workload. How would it work if I was assigned a facilities task or an IT task? And what would some sort of a response look like? Because oftentimes, and especially Heidi alluded to this, you're going to find that oftentimes your facilities management and HTM aren't necessarily working in the exact same system. And even in the case of Nuvolo, they are separated applications. So how would that crossover work out? And it works very simply. I'm going to pull up a connected workplace technician, and now I've got any of my tasks that are actually split between different areas. So for instance, if I look at my tasks due this week, I've actually got my clinical work orders that are due this week, and I've even got a facilities work order task. So very similar to what we had done as far as getting IT to come take a look at our workstation, I've got a task to assist somebody in facilities. So let's take a look at what this may be. All right, so they want me to back them up with an OR manager. So odds are it's a discussion and an OR manager has some concerns about something. So let's go ahead and see maybe what this is related to. Okay, so they've got a particular unit that will not power on. And I know based on this naming convention that that's actually an air handler. So now I can reach out to Colin and I can say, I'm totally available to go up to the OR and have a discussion with you. What time works for you? And it just makes it that much easier to really make a coordinated effort. Next, I'm going to go through our connected workplace environment of care. And another benefit of really taking this connected thought process and trying to really align yourselves with it, depending on your structure, especially if you're in a smaller acute facility, you're going to have some reports that you need to give to the COO for that particular facility. And they don't necessarily always want to look at facilities and HTM separately. They may want all of that information together so that they can better understand what's going on with their site. So we've done that here. We have our PM area where we're going through what have we actually completed, what's failed, and then what were we unable to take care of because it was in use or we were unable to find it. really our corrective maintenance information, and also some areas where we may need to provide some clinical training, and that's going to be identified through user error and improper use. Our recalls, and also our adds and deletions to our inventory. We've got our PM completion, which is always very, very important to ensure that we're in compliance. Again, another view of our corrective maintenance. And then we may also look at any of our like PCR analysis, our problem cause resolutions. And what's cool is you can even see right here, any of these work orders that start with an F are facilities, and any of these work orders that start with a C are clinical. And so now we've gone through and we've taken this information that was really isolated, and now we've combined it so that our COO is not necessarily having to go through multiple reports to understand exactly how their facility is performing. All right. Heidi, before I hop over to capital planning, is there anything you'd like to add?
No, I was just thinking though, one thing that it was worth noting is that a lot of times what happens is that you think one particular department might be responsible for something. So especially when it comes to electronic medical record or something like that, and you say, okay, this is an IT issue, I have to assign it to IT. IT does some investigations, like, no, this is not mine, and then they send it back. Again, in the past, in current legacy systems, the way there's no tracking mechanisms for determining what I call the ping pong effect, and that is, nobody's taking ownership of it, and so it goes back and forth without any real visibility, and ultimately it just escalates after the client, or the customer, I should say, end user clinician gets angry and calls somebody. So this way, through this method, you can track that ping-ponging, or quite frankly, stop it in its tracks so that the issue is resolved immediately, versus just going back and forth for sometimes days and weeks.
Absolutely. And the other piece that's really nice about it too is a lot of times when you're going through that, the ping-ponging effect, you're stuck trying to research, who do I call? And with this, as long as your organization has some sort of routing rules, you don't have to worry about that anymore, because the system is going to make that call for you. All right, and so now our last example that we wanted to go over was really capital planning and what this could look like in a connected environment. So right now, as we're going through and we're trying to prioritize what equipment needs to be replaced, we're doing it as simply healthcare technology management, and we're working with clinicians to ensure that they're getting the appropriate devices fixed based on failure rates and clinical needs. But what happens when we lose priority to facilities, and why would we lose priority to facilities, and is there a way to combat that? So instead of having simply an HTM capital planning report, what if we were to combine the two and give ourselves an opportunity to really stand side by side with facilities so that we can make a more coordinated effort? So you can see here, this is what my HTM capital planning dashboard looks like. And what I'm about to show you is the same information, but we've also got facilities here as well. And so now we can have a conversation sitting side by side with facilities. For instance, we've got, right now, it looks like they've only got $3,600 worth of assets that need to be replaced, and we've got about 63,000. And so we can start that prioritization effort knowing what our cost of service ratios are, and also, as we get down here further, how quickly, what our asset conditions are. I mean, as we look through the needs to be replaced on here, we can see that from a device count perspective, facilities is a little bit higher. but the dollar amount likely is higher with HTM. And so instead of having to go back and forth and really, instead of making your pitch case specifically to finance, you can now coordinate with facilities and you can go together with finance with your own prioritization, and it'll assist that you don't get knocked off the block. And I know, as someone who worked with finance fairly frequently, in trying to ensure that our projects and devices got through in that capital planning process, I know that if I had a way to better coordinate with my peers, I think that I would have been able to get my devices prioritized more often than if I hadn't had something like this. And that is really our demo. So with that, I'm going to go ahead and go back to our deck. And we've just briefly talked through the connected hospital and ways that we hope that we can support teams, locations, assets, and business services to better be coordinated, with the idea that we can collaborate, track and report, and ultimately improve the total experience. And we do this through our solutions spanning maintenance, space, projects, real estate, and sustainability, ultimately protected by our operational technology cybersecurity tool. And with that, I'll turn it back over to Linda.
Okay, thank you so much, Dustin. Yeah, we've had a few questions come in. So the first one is, can this connected hospital solution also allow me to bring my outsourced service providers into this to complete work?
So it's an excellent question, and the answer is yes, if you have a big enough stick. You can absolutely get external suppliers or independent service organizations or OEMs to fill out work orders within Nuvolo. You would likely have to have that written into your contract, but it can be done. Or the alternative is you're simply having engineers go ahead and create those work orders based off the field service reports or some sort of administrative task. But yeah, if you can get the OEMs and ISOs on board to work in the system, you're golden. And all of your contract information is going to be spot on. You're going to have a better understanding of when you're getting value out of contracts versus when you need to renegotiate. Great question.
Okay, that's great. And another question here is, can I show the relationship between IT, facilities, and HTM so I can see their dependencies?
Absolutely. And that was what we had shown on the MRI and how we had actually stepped through to create that work order for the chiller.
Okay. Another question here is, can other healthcare departments like linens, pharmacy, and nutrition services also use this solution as well to manage their assets and work orders?
Yeah, it definitely. There's anything that ultimately needs to be tracked, from the cost structure, understanding like what it costs to maintain that, anything with PMs, anything under contract, you could absolutely track that within Nuvolo for those different groups.
And even dispatch and tracking of assets as well, just to add to that.
Okay. Interesting question coming up here. My HTM is being asked to cut costs. How can this help?
So the easiest area for it to help you cut costs is always with contracts. And what I mean when I say that is our platform makes it much easier to see where you're winning and losing, as long as you're filling out those work orders appropriately based on the field service reports. And oftentimes, unfortunately, you aren't always getting the value out of your contracts that you really should. And so this tool, Nuvolo, gives you an opportunity to really assess those with a fresh perspective, because you can see the dollars really trickling up, and in an ideal situation, over what a contract is costing you, which would imply you're getting the appropriate value. But a lot of times you may find that the value that you're getting as far as the cost of, if you went time and materials, is actually under the stated contract cost. So that's probably the biggest area where you would be able to see those immediate cost savings. Heidi?
Yeah, and that would be immediate cost savings as well. But you know, I also want to add that in the current environment, I think if everybody, you know, if you're working in a hospital now and you really look at, you know, how much time you are spending trying to you know, track down data, trying to, you know, collaborate with other departments, extra duplication of efforts that happen because you're having to go back and figure out what was already done. Now you have to go back and do it again. You know, and again, just in the waste that goes on, calling in vendors that might not have been needed, all of those things. Again, ultimately, the evolution of the hospital setting is that there needs to be more collaboration. It cannot be working, you just can't work independently anymore, because all of these different departments and processes and things that need to take place have interdependencies on each other. So again, this tool, what it really does do is help streamline those, prevent duplication of efforts that requires more people, more time, more everything, and streamlines that. So there are cost savings ultimately because it's more efficient. And you know, whether you're looking at having hard dollar cost savings or soft dollar, you know, I need to do more with the time I have. This tool does help you do that, because again, you're doing things faster, you're getting the data that you need to do your job faster, better, and then ultimately document that the performance or the cost savings or whatever it is that you're wanting to track is heading in the right direction. So, you know, I would add to that because I think it's such an important piece of it, and operating in silos is no longer an option. You know, if we look back on the evolution of how HTM started out, you know, we started out in the facilities departments, and then obviously it became its own specialty type of area, focusing on clinical equipment, and we had paperwork orders. If you recall, if you've been around as long as I have, I remember the paperwork orders. And you know, you'd follow those paperwork orders away, and obviously there was no data transparency with those paperwork orders. And then we, you know, CMMS systems evolved very quickly, but they were clunky. You couldn't run reports. They had maybe 3 standard reports that you could run, and that was it. And then, you know, as this evolution continues, then you have legacy CMMS systems that obviously have more abilities to look into things, but there is no interdependencies, no way to integrate with you know, your ERP systems, with your cybersecurity systems, and that's what this Nuvolo is. That's that next evolution that allows, again, that connected hospital, connected workplace, and truly allows the organization to do many different things at the same time with full visibility. So, you know, that's kind of, I think, when we talk about cost savings, it's also time savings and efficiencies and performance improvement and all of that.
Another question here. How can I get a demo if it's available?
So if you go out to the Nuvolo website, you can make a request there, or you could even send an email to the email that's actually on the screen right now, just sales@nuvolo.com, or even call that phone number.
That's great. Thank you so much, Dustin and Heidi. We don't appear to have any more questions, so we will wrap up now. Thanks for a really and thank you again to today's sponsor, Nuvolo. Just a quick reminder that the post-webinar survey and certificate process, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. After the survey, you'll be able to download your immediately. Questions, please contact us at webinar@mdpublishing.com. And for more information about all our upcoming webinars and of course our webinar week, please visit our website .live. Thanks again for joining us. Enjoy the rest of your day, stay safe, and we hope to see you next time.